Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Carotid body tumor, and it is the chemodectoma or the non-chromaffin paraganglioma. So this arises from the chemoreceptor cells on the medial aspect of the carotid bulb. It is typically benign. It is unifocal. It is benign and it is non-hereditary. It is classified using the Chamblin classification. It is approximately about 10%. There is about 10% have a positive family history, and the higher the incidence of the individuals living in the high altitude. So it increases with the higher altitude individuals, and this is due to the chronic hypoxia and leading to the carotid body hyperplasia. So it is due to the hypoxia. Next is, what are the clinical features? So C of the clinical features, what you see is it presents as a painless, slow enlarging. So it will be painless and it is slow, and then there is also the enlarging. So it is painless, it is slow, it is enlarging, and it is rubbery and pulsatile. So it is rubbery as well as it is pulsatile and mobile swelling. It is audible brute, it may be heard. Audible brute, it is heard. So how to diagnose this? The diagnosis will be by the carotid angiography. There is the Layer sign. What happens to the Layer sign? So in case of the Layer sign, there is a splaying of the internal and the external carotid arteries. So splaying of the internal as well as the external carotid arteries. Next, when you look at the contraindications, it includes the FNAC. The FNAC and the biopsy are the contraindications. So investigation of choice in carotid body tumor is going to be only carotid angiography. Now, how to treat this carotid body tumor? The treatment is, in case of elderly, the observation may be preferred as the surgery is avoided. So surgery you avoid and you mainly look for the observation. The tumor is benign and it exhibits a slow growth. If the tumor it exceeds 3 centimeters, the preoperative embolization it may be performed. Next is in case of tumors exceeding 5 centimeters. So where the tumors it exceeds 5 centimeters, the excision of the carotid body replacement is considered. So excision with the carotid artery replacement. So excision of the carotid artery replacement it is considered. Now the tumor it rarely metastasizes and the overall growth is slow. Hence the need of the surgical removal should be considered carefully and owing to the potential complications. Next, what are the complications? The complication is, it can include, the main complication is from the resection is a cranial nerve injury is the most common, and most common will be the superior laryngeal nerve. Then comes the first bite syndrome. The first bite syndrome is characterized by the pain upon the initiating the mastication. Upon mastication, you get the pain. Next is the bilateral carotid tumor excision. So carotid tumor excision. So here it can cause a baroreceptor reflex. So BR reflex can be seen, and this can lead to a wide fluctuation in the blood pressure. So there is a fluctuation in the BP, that is a blood pressure. To learn and grow daily like this, please do subscribe. you.